side mode as well. It should be on the top of your screen if you're using the laptop as well. Okay. So, hi everyone. Thank you for taking the time to attend today's webinar. This session is organized by Physio Asia Therapy Center and Academy. For those who are not familiar with us, we have been open since 2006, and we have been providing physiotherapy services across Asia with clinics not only in Singapore, but also in Malaysia and the Philippines. You may check us out on our website, whereby the link will be posted in the chat box shortly after. So today is part 2 of Physio Asia's Academy's ongoing Women's Health series. Last time we covered urinary incontinence, and today we will be diving into menopause, focusing on how to optimize breathing and sleep during this transition. We are very pleased to have Monica Verma, our clinical director and senior physiotherapist from Physio Asia Therapy Center with us. Monica is a highly experienced physiotherapist with over 30 years of experience, and she'll be sharing her expertise on today's topic. Yeah, Monica. Monica, I think you're muted.
Thank you, Shang, and good evening to all of you.
Can't hear you, Monica.
You can't.
I think I can't hear you.
Sorry. If any of you guys can raise hands if you can hear me, because on my side it seems fine. Yeah, I think it's just you, Shang.
Oh, okay.
All right.
Then I guess it's me.
All right. Sorry, guys. Well, thank you for taking time out this evening right after work. I guess most of you must be just finishing work. Well, whether some of you are already in menopause or going to be there soon, I hope this talk is useful for you guys. Amongst a lot of other issues that occur with menopause, as Shang mentioned, today we're talking about its effects on breathing and sleep, which are two major aspects of our life. And in some cultures, actually, menopause is seen as like a time of wisdom, like you've gained some power and you are like the mature girl or mature woman, whatever you want to call. And that's like your badge of honor. So I like to think of it that way. Well, of course, there are associated problems that come with it, variety of issues that we go through. And like I was one of these pictures as well at one time. So I'm postmenopausal, but this was like, if you talk to me like 10 years ago, I was one of these women mentioned in these pictures. So even before I had started my journey of menopause, as I had been practicing, I am a practicing physio, and I used to get a lot of these female patients who would just come in on the first session as we're talking. They already burst into like big cries, and like they have like a list of symptoms. And I used to wonder like what could be wrong. It doesn't fit into a particular sort of description that I have learned as a physio. And neither were we taught in menopause about menopause as much when we studied physio and women's health. And also, as I talked to some of the doctors, this is not an area that very well covered. It's only since 2016 that this particular topic has been given a lot more attention. There is a lot of research now, and there are actually more discoveries in how menopause changes us and how do we sort of manage those changes? How do we sort of take care of ourselves better? For the first few years of my perimenopause, like that's my experience I'm just sharing, I wasn't even sure what I was going through. It was like a very strange feeling. I will be reaching the fridge and I'm depositing my clothes in the fridge. I'm reaching for a wardrobe and I'm looking for a cold drink. It was like just sort of a mental fog. I'll wake up in the middle of the night, like drenched in my own sweat. It'll be like anxieties and panics and like very sensitiveness. Like mine just wasn't sort of thinking right. It just wasn't doing the right things. And I was wondering, like, am I going senile? Am I going crazy? I can't remember things. I just forget things very easily. And I was I kind of was temperamental. So I had told my family, I'm going through this big puberty phase in my life. I'm a teenager now. You've got to all put up with my tantrums. And fortunately for me, my family and my work colleagues probably listened to me, and they sort of were okay with that change. They were very helpful. They will see me doing weird sort of things. I'll be walking around with the fan around me. I could be like at times cranky for no reason. I could be just sad for no reason. But then I did take charge of it because I had experienced these with other women that I had been working with before, or even with my friends. And sort of I understood that this was a temporary phase. It's a transition that I'm going through. So I think a lot of us go through these changes over the years. And as I talk to my friends or other patients or colleagues, these are like common experiences all women sort of go through, maybe to different degrees. So let's remind ourselves that we are all in this together. Now, getting down to the business of today, which is basically learning something about menopause, it's a transition in life, which is kind of inevitable. It is different for each of us, but it is essential for us to understand what happens to us, what our bodies and mind go through during this phase. So it's not just, we think of menopause as just something related to lack of sex hormones affecting our reproductive system, affecting our cycles, but it's much more than that. There's a huge linkage of these hormones, which are majorly produced in ovaries, of course, to the neuroendocrine system. Endocrine system is basically like a combination of hormones that operate our different organs to their optimal level. And that is hugely linked to how the brain controls these functions. And brain, a lot of these functions are depending on how estrogen sort of is absorbed. The receptors are very much present in these major organs of the brain, or parts of the brain rather, which send signals to different parts of the body to do certain things. So estradiol, which is a type of estrogen, it is known to produce energy in the brain, because brain is a structure or is an organ that uses a lot of oxygen and uses a lot of glucose to do the various metabolic processes to keep us functioning in different ways. So the higher the level of estrogen, the higher the brain energy. When the estrogen goes down, as the changes happen, then as much as the neurons in the brain slow down and we tend to age. There can be also plaque formations, which is basically deposits of, you can say, fatty cells in the brains or the arteries, and that changes the circulation of these very important structures. Well, how many of you have ever felt like your body was playing a game of guess the temperature today or guess the temperature right now? You know, your temperature controls, they become so unpredictable as the weathers of today around the world. We never know where it rains, where it's so hot, and why is it so cold. Just the same is what happens to us. Hypothalamus is a part of the brain, as you see in that picture, where it sort of controls the temperature. It's like the thermostat of our body. And that regulation is very much dependent on the presence of estrogen. There are a lot of receptors that help control that function. So when the estrogen starts declining, your thermostat goes off, or it goes haywire. So you have various variations in the temperature in the day. It can be like suddenly very hot, and suddenly in a moment you sort of just sweat and you kind of cool down. That's like a common occurrence. It's one of the major symptoms of menopause. And also often people complain of sleep disorders or mood swings. They become very, their memory lapses. They have like brain fogs, can't remember things, just like I went through. And these are like basically depending on structures called amygdala. If you look at this picture, let me minimize this. So this little structure here, which is just parallel to the inner ear, like just above this behind the temporal bone, this is a little structure which is controlling your emotions. So when there is a lack of receptors from estrogen, amygdala starts going haywire. It sort of sends too many signals. It keeps us in a fight and flight mode, which is basically keeping us on the edge, and we kind of we're worried, we're anxious, we can't handle emotions very well. We just become very sensitive. This is in close relation to a structure called hippocampus, which is basically the memory center of our brain. So if you have been through these symptoms, you would know, like when you're feeling anxious, you're edgy, you can't focus on things, your concentration goes off. You forget things easily because you're not in a state of absorbing what's going around or what you're trying to absorb. So these are changes that are happening in us during this transition phase of us becoming menopausal when the periods are about to end. But good thing is now the new researchers are trying to find out whether we actually recover from these changes. There are options, different options, which I'll go through, which help us manage these better. So we can regain a lot of these controls after a gap. So it just needs a little more work, a little more effort. Now, menopause can be surgical, where women have gone through hysterectomy. It can be a total hysterectomy, which means the ovaries are taken off as well, and that stops the production of estrogen already in these women at an early age. Or it can be just spontaneous or physiological, which is bound to happen with age as we go through the processes of life. Now, perimenopause, if you look here, this is like we call it premenopause, which is the period before we actually enter this phase. So before 35 years of age, we still have like a peak of hormones. We're still very active. They're called the very productive years of our life. Pregnancies are easy to happen during that time because your number of eggs, your cycles are more in control. As we get to 35 years of age, that 35 to 45 years, it can be different timing for each of us. That's the perimenopause phase. We enter that phase where there is this gradual decline of the hormones. These hormones start reducing, and they may have like an effect on your menstrual cycles. The cycles become more erratic. They can fluctuate in terms of volume. They typically become heavier nearing the end of that perimenopause phase, which finally leads to a menopause phase, which means you haven't had a period for 12 consecutive months, and which can be anywhere from 45 years of age to 55 years. So, of course, they say the later it is, the better it is, but then we do not have a control on it. It also is connected to your genetics, your lifestyle, and your diets. All those play a part in these as well. So by menopause, estrogen, progesterone decline significantly, and that's where we are already setting in these changes that we've been going through in the last 10 years. So typically, they say 7 to 14 years is the time cycle for a peri to meno to happen. Generally, most commonly, it's 7 years, but for some people, it can extend longer, which means they have a little longer impact of this. And post-menopause is where it's like following the menopause, you've completed those 12 months of no periods, you've already entered post-menopause. So that is forever then. So we need to focus on that peri to post-menopause period where we sort of manage ourselves better and manage these symptoms better. Now, we would just like to have a quick poll here. Shang, I'll need your help. Thank you.
Yeah, can everyone see the poll?
This is just for us to know how mixed a group we are. It's like interesting to see that we have a lot of premenopausal women as well, which sort of is good for us to be prepared for what's to come. And also for us who've already been there or going through, we just sort of try and make things better for us.
We'll just wait a bit longer until the
Oh,
rest.
sorry,
will
there
go
is,
up.
I think, a spelling error. The first one is premenopausal and the last one should have been postmenopausal. So sorry. That's pre, that's peri, that's menopausal, and there is postmenopausal. So the last option is postmenopausal. Sorry about that.
Okay, I think I will end the poll now.
Thank you.
And yeah,
So
yeah,
we
here are
have,
the results.
right, thank you. So we have 21% people who are currently going through it in some way or the other, or some like have been through it. And we have a lot of younger women, which is very nice to see. Good to start knowing about it more so you can tell people about it, you can sort of manage yourselves better. I mean, I felt that it helped me. Okay. All right, let me get back to my slides. Okay, why do we need to know about menopause? What is important? Because it has major physical and emotional impacts. It's essential for women experiencing menopause to seek support from specific healthcare professionals who might be able to help them, their family members to manage and understand these changes that these women are going through so they can support them, which is very important for their own recovery and their management from this. Long-term health is another criteria which is important because postmenopausal women, they have increased risk of osteoporosis because of the declining level of estrogen, which is basically reduced bone density. They are prone to fractures and bone injuries. They have also more probability of suffering from weight gains or cardiovascular diseases because estrogen lines up the inner side of the arteries as well, keeps them flexible and soft, keeps them healthy. But when estrogen is declining, these become rigid, they're less flexible. So the fat starts depositing, and that's where we see narrowing of the blood vessels, which can increase blood pressures, causes the risk for cardiovascular disease, and weight gain is, of course, a common thing. Like I used to walk around, I felt like I had this tire around my belly for like 3 years. I didn't know what to do with it, with whatever amount of exercise I did, whatever I did just didn't go. It wouldn't want to go. But yes, later, of course, as I started working on things, it did sort of improve. It's just knowing what levels are safe for you, what you should be doing is helpful. And of course, social and economic factors, because women today are working, they are sort of holding big duties and big responsibilities. So having some support in the work environment makes it easier because they can sometimes have these different changes which might affect their performance at times. Not that they're underperforming, but it sometimes can cause different issues. So helping them in that way. Socially as well, because we're living in a world where like aging, there's a lot of anti-aging world that we have. So yes, it's good to think about that, but not like there are some sort of changes that we have to accept in some ways and then work on making them better. So there is a lot of change in terms of even dealing with your spouse or your partners because your intimacy can be affected because there are changes that are happening in your system. So we need to just sort of be aware of these impacts of menopause on life in general. Now, there is like a huge list of symptoms that one can experience. Some women can have no symptoms, and some can have moderate symptoms. Majority will have moderate symptoms, but some can be really, really severe. So, menopause brain is like, I say it's like a longer sustaining extension of a teenage brain or a mommy brain, like during pregnancy, because during puberty, during pregnancy, the brain goes through a lot of changes because again, it's like a change in the hormone levels. So when there is a change in the hormone levels, it does affect the way we function. So, I mean, looking at the list of symptoms, we're not crazy if we complain for like about some symptoms out of this or more symptoms. They are actually real. These do happen. I have had friends and patients who've gone through scans and MRIs and whatever else to sort of deal with each symptom or whatever presentation has been, because they go to the specific doctors and they would address only that specific issue and not necessarily that they would find a cause. It's good to rule out any other issues or problems, but majorly at times there is no finding. So that is basically, then it's good to check on your hormone levels and see if that is causing the change in you. So every woman's experience with menopause is very different. And we need to just sort of see how we manage these again better. There are different categories of symptoms, like vasomotor symptoms. Basically, it's like related to, or it's causing constriction and dilatation of blood vessels, which means it's affecting the blood flow to a certain organ or part. So which will include like hot flashes, the major symptoms, which 75% of women might experience at some time or the other. Night sweats, like it's like they are soaking in sweat at night suddenly, just even though they're sleeping in a cold room. The frequency and intensity can vary from one to the other. They can have migraines, they can have palpitations, so migraines like severe one-sided headaches, reaction to light and sensitivity to noise, palpitations, which is basically a racing heart. The heart is like constantly running because it's just not settling. It's like a lot of stress to the heart because of the change in circulation. They can be psychogenic symptoms, which is basically it affects the way your brain thinks or works. So there can be sleep disturbances, which are noted in like 40 to 60% of women. They can be problems like falling asleep. They can't fall asleep to begin with, or if they do fall asleep, they just wake up early. They can't stay asleep. It can also cause mood changes like depressions and anxieties or mood swings. And 20 to 30% women would complain of that as well. There can be cognitive changes, like I had brain fog, like suddenly I'm doing something and I'm there to do something else, but I just can't remember what it was. There's like a total gap. And then I'm spending next 15 minutes thinking what was I standing here for? So they also have difficulty concentrating because there's like a blurred brain for a while. It's not permanent. Just remember these changes are manageable. There can be changes in urinary means genitals, which is basically your sex organs. And up to 50% women can report like vaginal dryness, difficult intercourse because of that, reduced libido. Also common is increased occurrence of urinary tract infections, which is UTIs, or even incontinence in some cases because the pelvic floor just goes too tense and it's just not able to assess the actual filling. The other physical symptoms will include shortness of breath, like they feel the chest is very heavy and tight, there's congestion of the chest. Some women report nausea, bloating, or even constipation. So it can be any type of digestive changes, also because your breathing changes, and that affects the mobility or motility of your intestines, and that may lead to digestive issues, and also it's linked to your emotional disturbances. There can be changes in the skin. The skin becomes drier because now the second layer of the skin, which is dermis, it's very much the collagen, which starts drying because of estrogen being lesser. So there's dryness of skin, there is hair thinning, there is increased hair fall. And one of the major complaints in a survey in Singapore as well showed like a lot of majority of women do report of joint and muscle pains, which is a very common occurrence worldwide as well, 40 to 60%. And Singapore, that's one of the major reported causes or rather results of menopause after the hot flashes. And fatigue, because of all of these that's happening to you. You kind of get tired, you fatigue very quickly. Long-term risks of health risks in postmenopause, as we had mentioned before, cardiovascular health and bone health, as I had told you earlier, and even cancer risks sometimes are reported postmenopause. So it just makes us more prone to this, and thanks to doctors like researchers like Dr. Lisa Mosconi, Dr. Mary Claire. Lisa Mosconi is a neuroscientist. She's done a lot of work on Alzheimer's in women as well as like brain changes in women. And Dr. Mary Claire is a gynae. She has, of course, she is a lot more into hormone replacement therapy, but as well as like defining just the symptoms, the changes that the women go through post menopause. Right, let's just have a quick poll again, just to know ourselves better. Shank, I'll need poll 2. Thank you.
Yep.
So this, of course, doesn't apply to premenopausal young ladies here. And these are all confidential. Nobody gets to know who has what.
I'll just wait for 10 more seconds before I close the poll. Okay.
Okay, so amongst our group itself, we see 67% suffering from anxiety. I was one of them too. Sleep disturbance, I also was one of them as well. So those two like top the list, very common. Good to know. Hot flashes aren't that common, so but they are still significant. Like it's 22%, which is like 1/5 of the population that we have here. Brain fog, weak bladder. So that's quite significant. Let's see, what else do we have? Digestion issues, 44%, and palpitations as well. So a lot of these symptoms here like are linked in some ways. Hot flushes, sleep disturbances, brain fogs, they kind of fall in the same category with anxieties and altered breathing. So they kind of are interrelated and do affect each other in some way or the other. So let's go further. Now, do we know women actually breathe different? There was, if you know Charles Darwin, who is the father of evolution, theory of evolution, who told us how we evolved um, as a human, he had stated in his researches then that women have an inferior brain compared to men. So hence, it took us that long, like century over, to start giving attention to women's brain and understanding what changes women go through or what their brain goes through during menopause, because we're kind of born similar. But then why are women sort of, because that was like a statement. So there was very little research done on women's issues then till, again, as I said, very recently, this has sort of taken on. Likewise, there has been a difference in women's breathing from a man's breathing because of the cycles that we go through, because of the change in hormones that we go through, which a man doesn't need to go through. And probably that's why it makes us more resilient, because we deal with so many ups and downs in our life. And so yet we emerge winners. Now, why women breathe differently, how women breathe differently. We hyperventilate during the second half of our menstrual cycle, which is a known fact, which is like women, basically when the progesterone levels are rising, we are hyperventilating, which means we are breathing in very fast and out very fast. The in and out is very fast. We're breathing bigger volumes of air. And each time we're breathing out fast, we're actually throwing away carbon dioxide and reducing the levels of carbon dioxide, which I'm going to talk about later when I address the breathing, is a contributing factor to fatigue, to lactic acid buildup, to anxieties as well. So this is like one major thing. And women, like those who are in premenopausal period presently, it's good for them to know how much to manage this hyperventilation phase during that 10th to 22nd day of their cycle, because that's when you kind of have increased incidences of these symptoms as well. Lung function generally goes down as we go through the years and we go through the transition of menopause, and it actually, so it sort of stays on a decline. So the lung function, again, is going to affect the breathing, and that's an important aspect for what we're going to learn today. Now, if you see changes to breathing during transition, like these are different factors to it. Lower lung function, there is hyperventilation, which is reduced breathing, which causes loss of muscle tone and bones, which can lead to, with all these, there is weight increase because there's slower metabolism, your biochemistry is changing, and that can lead to fat deposits in different areas, and particularly the throat and the belly. So this is important for the throat because that can cause obstructions to breathing. So putting on weight in these areas or in the belly can affect the diaphragmatic excursion. These are important factors we need to pay attention to. Now, what are the effects of menopause on breathing? So if you look at this picture on the right side, the normal airway allows the airflow right through the nose into the air passage, and there is nothing obstructing it, which is how it should be to maintain normal breathing. But if somebody has an obstruction to that, or somebody who does loud snoring, somebody who has sleep apnea, sleep apnea is basically sort of like, if you look at this graph, they are breathing normal, there's a normal breath, and suddenly there is like a gap. So that gap, which is this flat line, is basically holding of the breath. Suddenly there is no breath. When the brain gets the signal that this person is not breathing, there is like lack of oxygen to the brain triggers the breathing cells to suddenly catch up on the lost breath. And then there's like if you sometimes pay attention to people who snore, they'll be snoring or they are like just breathing very loudly, and suddenly there's like a sudden quiet phase. And then after a second, there's like a huge snort, and they're catching up with the breath. That's the brain signaling that I have to catch up this breath, otherwise I'm short of oxygen. So that catch up of breath, and again followed by a period of apnea. So this can happen because of an obstruction somewhere around behind the nose, into the throat, behind. So this is commonly seen when there is changes in the fat distribution around the throat, or there is an actual blockage or narrowing of the airway, whether it's just tension, anxiety, stress, which causes changes in the breathing. People with asthma, the symptoms do get worse during menopause. And that again is depending on, because the airways get constricted and tight with the lack of hormones. Muscle strength of the breathing muscles goes down at times because of, again, estrogen being less in the body. So these are the different effects of on breathing. Now, besides this, if you look at how we sort of breathe, it also causes stress, anxiety, anger. This whole loop sets in where if you have quick breathing, if you're breathing very fast, there is hyperventilation. It actually would lead to blood vessel constriction. Why? Because you are not accumulating some carbon dioxide. The lungs have to have some storage of carbon dioxide during the gas exchange, because if there is carbon dioxide, only then your blood vessels will release the oxygen to the rest of the tissues. So your oxygen is traveling in hemoglobin in a locked state. 98% when you measure with your oximeter. 2% is the free oxygen that's available in the blood in general, revolving around the body. That 98%, which is locked in the hemoglobin, needs the key, which is carbon dioxide. So when you breathe in slow and you breathe out slow, you're giving enough time for that carbon dioxide to approach the hemoglobin, unlock, release the oxygen, get into the hemoglobin, walk back to the lung to purify again. So if we have lack of, we just don't need only oxygen, we need carbon dioxide to breathe as well. Otherwise, it will cause constriction of the blood vessels, because carbon dioxide is a relaxant for your airways and your blood vessels. That's why when somebody is in like a panic, or like if you've seen in the planes, they give you a paper bag. If you have nausea or you feel anxious or you have anxiety, you breathe into the paper bags. You're actually breathing back the carbon dioxide that you've exhaled into the paper bag. That carbon dioxide enters back, relaxes the airways, relaxes the blood vessels, and actually improves the oxygenation through the brain, which was causing that anxiety or, keeping you in that fight or flight mode. So carbon dioxide, of course, required ratio of both is important. So we need carbon dioxide as well. So there is less stress. We're not anxious. Our vagus nerve keeps us calm. Amygdala, which is the emotion center, sends us an anxiety signals or keeps us in fight and flight, stays quiet because it knows you are regulating your breathing well. And that's an important tool in managing menopause symptoms, which is why breathing is an essential aspect of this whole management. Now, how does it affect sleep? So what is insomnia? Insomnia is basically not being able to sleep well. Either you can't sleep or stay asleep. So, which is because of the changed hormonal levels. Hot flashes and night sweats keep us awake because that keeps disrupting the quality of sleep. Restless leg syndrome, not sure if you guys are aware of it. Like, it's basically the urge to just move the legs, can't sort of keep the legs quiet. So it's like you need to move them, which again will keep you awake because there is a lot of movement happening on the legs. Mood disorders, anxieties, depressions can lead to sleep disturbances because mind is not calm. It's like a lot of thoughts, which are keeping you awake. And pain, of course, is a huge factor. And as a physio, we see people for pain. So it can be like exacerbation of the different kinds of muscle and joint pains, which can, of course, affect the quality of sleep. And overactive bladders, because there is a different signal to the bladder now, or increased urinary bladder irritation, which can cause frequency of going to the toilet much more at night. And that again is related to sometimes a weaker diaphragm, which is one of the core drivers for your bladder to be functioning right. So we need to sort of be mindful of that. Now, lack of sleep also is definitely combined with these factors, because if you don't sleep well, you've not recovered well from your day's activities, you are not going to be very clear in your head. So poor healing of mind and body, and then the related symptoms that we have with emotions and memory and the general engagement of the brain. Now, let's just check how do we breathe. Good to assess it on our own so we know where we are at present and how do we correct this.
I'll leave it on for 10 more seconds before I close the poll.
You can just put your hands on your chest, on your belly, on your ribs, or put your hand under the nose and see where the breath is happening. And just see if that's consistent speed, or if the breathing is like too fast, too slow. You can just take a self-measure.
Okay, I'll end the poll now.
Thank you. So 31% people breathe slow. That's great. We want to, we want to be breathing slow. Fast breathing is to be changed. Upper chest breathing, again, that is mainly the upper lungs that are taking part in the breathing. We need to bring the breathing lower down into the lower parts of the lungs. Belly breathing is something I would like to talk about, because often in yoga, I hear people saying they do belly breathing, but we need to make sure that it's more diaphragmatic rather than abdominal, because belly breathing can be both types. Lower ribs and belly is perfect. Nose breathing is what we want to strive for, because mouth breathing is shallow breath. So we need to make sure that we make the breath go deeper. Okay. So how do we improve the breathing? What do we need to do for breathing to be better? Of course, physical activity in today's world, and especially in Singapore as well, government also encourages, and I'm sure in other countries too, to be physically active for 30 minutes a day or 150 minutes of exercise a week, which is a great thing. Because physical activity, which includes some cardio exercises, it can be walking, it can be simple works. It doesn't need to be all high impact stuff. Walking, swimming, cycling, anything that suits you and is within your abilities and comfort. Yoga, Pilates, take help, take trainers where you need to. If you're not sure of the techniques, do them right, so you don't in the process injure yourselves. Stress management is a big thing because stress leads to, again, a lot of those emotional issues and brain issues that we talked about, the symptoms that we talked about. So meditation and mindfulness are gaining a lot of importance nowadays, and which will help us with everything. Relaxation exercises like progressive muscle relaxation, which I'm going to go through in a while, and guided imagery, which is like, trying to help anxieties and promote better breathing, where you're kind of imagining a scenario which gives you that calmness, which gives you that comfort of sort of being at peace. So sometimes just going into that mode of imagination, like it's more of like, creating sort of a scenario and you being an actor in it who is very pleasant and happy and, enjoying the situation. So sometimes it's like a stop to the thoughts, which is important. Healthy habits, of course, smoking is known to be not definitely good for breathing for sure, as well as smokers generally tend to have, they are more prone to stronger symptoms of menopause. And maintaining a healthy weight through exercises will help with breathing as well as sleep. So why or how do we breathe? That is important. So we had this questionnaire on how each of us is breathing, and you had different answers to it. Now, as I mentioned earlier, carbon dioxide is important because carbon dioxide reaches the hemoglobin. Oxygen is coming into the hemoglobin, going into your body. And when carbon dioxide gets in connection with the hemoglobin, because you've taken, when you breathe in, it's a mix of air. It's not just oxygen alone. So that tiny bit of carbon dioxide, which is 0.04% compared to 21% of oxygen, that tiny bit is a catalyst. It's like it's important for oxygen then to be released from your blood to the body parts for them to use it for their functions, which is including your brain. So generally, when we take a breath in, we need to make sure the breath reaches on the lower part of the lungs. So we typically tend to breathe. Give me a second. In faster breaths, we generally go with very, very quick breaths where it's sort of coming in the upper chest, which means it's the upper lobes. Now, 2/3 of your gas exchange happens in the lower part of the lungs. If we just breathe upper chest, we are missing out on this part, which is rich blood circulation. That's where majority of gas exchange happens, which is why breathing needs to be deep and not big. Oftentimes we confuse breathing, deep breathing with big breaths. So we go, now that's a big breath, which is majorly locked here. It hasn't even had a chance to go down. So slowing down that breath, giving it enough time to reach right from the top of the nose, majorly nose breathing, and I'll come to that as well, why. So from the nose, entering the bronchus, going into the lower part of the lungs, which means expansion of your lower ribs and lower chest. The more that expands, the better that work of the diaphragm allows it to be expanding better. The lung muscles are working better, and that leads to a good gas exchange and hence better oxygenation of the whole system. Now that the hormones are declining, we need to feed enough oxygen to the brain because brain was depending on these hormones to help activate that oxygen absorption into the brain. Since that is now reduced, we need to create that availability. So, and that's how we do it. So a slow breath in, which allows the breath to reach here, and a slower breath out. So the breath is retained for some time in the lower part of the lung for that gas exchange to happen. So oxygen and carbon dioxide, sort of used carbon dioxide comes out, and the pure gas gets in for absorption. So that's where we are. Now, James Nestor, during COVID, this was a very good book if you all get a chance to listen to him. The Lost Art of Breathing, amazing book. I've been interested in breathing since a long time, but this book was like a good summary of why breathing is necessary, and how he sort of brought it back to the attention of the world that this is like a major healer for a lot of issues. Now, diaphragm is a hugely important structure for us. It is not just the breathing muscle, it is also a driver for your posture. It is also a controller for your digestion. It is also a controller for your vagus nerve activation, which is like that calm, that rest and relax system arrangement. It is also important for blood circulation from your lower body going up to the heart for clearance. It also controls that. So diaphragm is majorly worked with breathing, but it has a lot of influences on our body functions. And why nasal breathing compared to the mouth breathing? When you breathe from the mouth, which is why a lot of women wake up with, or even men for that matter, one, snoring, sleep apnea, because you've left the mouth open. 42% of the moisture from the mouth dries up with that mouth opened breathing in the night. Now that's drying your airways, making them like sensitive, because a dry area is like rough. So they're like air injuries, if you call it. So people have dry mouth, parched lips in the morning when they wake up. They wake up feeling fuzzy and like fatigued, because your body was struggling to fill the air in through those dry airways. Now, why nose? One, you keep the moisture retained. You're not drying your airways. Secondly, your nose, during COVID, again, they were doing a lot of research with nitric oxide. So they were even people use nitric oxide inhalers, which relaxes the airways. And if your airways are relaxed, it sort of lets the air go deeper. Because with the nose, if you just put your hand on your upper chest and your lower belly right now, just below the ribs, where the ribs meet in the center, take a breath in through your mouth, a big, normal, deep breath, as you call it, through your mouth, and compare it to a breath that you take through your nose, and see what reaches the breath deeper, because remember, we have to reach lower into the ribs, lower ribs. So nasal breathing is more pressurized, it reaches deeper compared to mouth breathing, which is a wider surface area, dry surface area. There's less pressure for that air to go in. So that is important for us to change. During exercise, during sleep, times when there is more demand for oxygen, nasal breathing will do you better. So it will help control the anxieties as well as the emotions management, because it is giving you enough oxygen, your brain is calmer. It sort of turns on the rest and relax system. So nasal breathing as much possible whenever you can, and all the time actually. So what are the benefits of diaphragmatic breathing? As I just mentioned, these are like different things that the diaphragm does, and hence we focus a lot more on the diaphragmatic breathing. And that's where we're going to learn now how to do some of these activities to just help improve the whole breathing cycles. So it's just training the brain again on learning the right kind of breathing, giving it the maximum benefit. I might overrun with time. I hope it's okay with all of you. So we'll just quickly go through some of these exercises. Now, we start with some postural training, which is, say, shoulder blade squeezes, just to open up the chest and get it ready for the breathing, which is basically you're holding your hands, clasp your hands. You can do them with me. Put your hands behind your head. Keep your elbows wide and open. It's almost like a cat and camel in sitting. We're just trying to stretch the pecs, open up the chest so these muscles are not tight and squeezy, because if it is, it doesn't let the air go down. So placing your hands behind, we're doing chest openers. So here, opening the arms as far as you can, inhale and raise your head up, forcing your elbows wider, stretch as far as you can, raising your upper chest, opening out the front. And as you exhale, bringing your elbows close, caving in a full exhale and rounding your spine down. One more time, inhale and up and stretch wide. Exhale and come and close in the front. So you could do 3 or 5 of each just to get this ready. Second one you can do is just hold on to the side of the rib, because remember, we're supposed to breathe in the lower ribs. If you just place your right hand on the left lower ribs, your left hand to the ceiling, sitting well with your feet on the ground, heels touching the ground. You're just leaning to this opposite side, which is your right side. Feel those lower ribs expand and take an inhale into those ribs. So breathe in as you lean to the right. Breathe out as you squeeze back. Breathe in and open to the right. Feel the left ribs opening out. Reach up further with this arm. You could stay there instead of coming back. Inhale, go further away. Exhale, relax. Inhale, go further away. Exhale and relax. And likewise, you do the same thing for the other side of the chest, holding on to the right lower ribs with the left hand, right hand reaching to the left. Reach, come back, reach, come back. So with each inhale, expand, widen. So you get those muscles stretched out and you get more space for the air to come in. Now, strengthening the respiratory muscles, there are, like, you get these devices, which is like inspiratory devices where you blow or breathe into these little pressure tubes, and there's a ball that lifts up just to strengthen the inspiratory muscles, and general strength training as well, which is important, which like regular exercises with weight training and stuff, which is, or with the bands, to help improve the strength. Now, we go through some quick breathing self-tests. Now, posture is very important when you do the breathing, or even in general for the day, when you're holding yourselves in a certain position. Basically, if you look at the first picture on the right, which is showing everything in alignment, the red is just opposite the red. So the bottom red is your pelvic floor and the top red is your diaphragm position. If both of them are just right in opposition to each other, everything is regulated well. Compared to the other pictures where the back is arched, or the back is rounded, or the back is like the front of your pelvis is tilted forward. So you want to try and align yourselves as much possible straight. So your breathing movement controls the lift of the bladder as well as the movement of the diaphragm equally well. Now, we check breathing rate, or respiratory rate as we call it, per minute, to know how fast we breathe. Like we had a question, what is your breathing level like? So if you just count one breath in and one breath out as one cycle, you count how many repetitions of that one in and one out do you do in a minute. That's called the breathing rate. Ideal for us in general routine, when you're just sitting on the desk and working, or you're just resting, should be between 12 to 16 breaths per minute. Anything more than that is hyperventilation, which means you need to get working on slow breathing. You need to do specific breathing exercises to bring that breath rate down. So this is something you can just randomly check on yourselves. Now, the next one is controlled pause, which is very specific breathing test to know the strength of your diaphragm and the breath control, where you're basically just sitting still. You could do it with me once. You're breathing in and breathing out normal, but through your nose, not through the mouth. I'm talking, so it's different. Breathe in and breathe out through your nose, a gentle breath in and a gentle breath out. On the breath out, you pinch your nose. On the breath out, pinch your nose and keep it pinched or hold the breath till you first feel the need to breathe, where like your neck starts giving you signals it wants to move because it wants to get air in. Do not go to the point of extreme air hunger. So your first air hunger sign is your count for the day or for the time, which could be 10 seconds, which could be 20 seconds, different for all of us, and different time of the day also it can be different depending on how charged you are in the day. So that is a test you can do at the same time every day, just for a week, not using it as an exercise. And anything below 25 needs to be worked, which means you need to work on your breathing to slow it down, to make it easy and keep it calm. And this is important test for managing your anxieties and the other symptoms or change in breathing during sleep. Now we go through some diaphragmatic breathing, which is, I'm quickly going to just practice one of each. We will share this video with you guys. You can look at it later to practice, but because of lack of time, we're going to be quick. Diaphragmatic breathing, as I said, abdominal breathing, often I see people when they say abdominal breathing, they're actually expanding their stomach, which can be abdominal work and not the diaphragm work. So make sure your abdominals are completely relaxed. The breathing should come from the lower ribs. So you could place your hand here right in the center where the ribs meet, so you can feel the rib movement, your fingers and your palm spanning to a bit of your lower ribs. Make sure the upper hand stays relaxed. Take a gentle breath in for 4 seconds and a soft breath out for 4 seconds. So starting with an inhale for 4, exhale for 4, and then working up to slowly, if you've done 3 breaths in that manner, increase inhale, stay inhale to 4, exhale to 6. If for those who are very fast breathers or find it difficult, they can start with a 3 seconds inhale and a 3 seconds exhale. So start equal, work up to 1.5 to 2 times longer exhale. Remember, breathing has to be light, slow, and deep. Do not go fast. The second one, for relaxation, we want to do left nostril breathing. Right is an activation breath. Left is a relaxation breath. So depending on the time of the day, in the mornings, if you charge yourselves with the right breath, that's fine. People do alternate, which is like to keep a balance. But if we're specifically trying to ease ourselves or pre-sleep, you want to calm down, only do the left nostril. So you block your right nostril with your finger, and you're just gently breathing in and feel the temperature of the air that gets into your nose. Breathe into the count of 3 or 4 through your left nostril. Feel that cold air come into the nose. And if you put your finger here, you can feel that when it returns, it will be warmer. That's a good breath, which means you allowed the breath to go in enough for it to change the temperatures. So breathing in cold air, out warm air. Again, a count of 3 and 5 and a 4 and 6. The pattern, the number timing remains the same. So that will be left nostril breathing, particularly when you want to relax yourselves and be calm. Now, square breathing, which is a controlled cycle of breath, which is basically a breath into the count of 4, out, hold for count of 4. So your inhale is 4 seconds, hold is 4 seconds, which means you take a breath in. You can do once with me, and hold, 2, 3, 4. Breathe out, 2, 3, 4. Hold, 2, 3, 4. So you repeat this cycle of 4, 4, 4. If 4 is hard, start with 3, 3, 3. So it's like a square breath. And each time in and out, you're holding it. So you're just extending. What you're trying to do here is, if it's 4 seconds breath, which means you're taking 16 seconds for one cycle. And that is roughly 4.5 breaths in a minute. 4.5, 3.5, 16, 48. Yeah, about 3.5 breaths. So like typically reducing the breath. So majority of the day, because we do 22,000 breaths a day, if you're breathing at a rate of 15 breaths per minute. If you're breathing faster than that, imagine the number of breaths. If you're breathing 20, you could be doing 5,000 extra breaths. And that is a lot of load on the system. So here we are compensating by reducing the breath further. This is for somebody who has anxiety or asthma or somehow getting stuck with the breathing. You're basically doing a normal breath in. So almost like control pause, but not that long. You don't want to do it longer than 3 seconds of breath hold, because for severe symptoms, you don't want the brain to be very alarmed. So you breathe in and breathe out. On the breath out, you pinch your nose, just count 3 in your head, and then let go. Resume the breathing for next 3 to 10 seconds, and then again pause for 3 to 5 seconds. Do this for just 2 minutes, and you can do it multiple times a day, or the times when you're feeling anxious or restless. It will help to calm down, and that regulates the breathing speed. Now, sleep, of course, maintaining a regular sleep schedule. How do we improve it? Sleep environment should be conducive, so you sort of have dark curtains or whatever else is needed, comfortable beds and all that. Limit caffeine and alcohol, and of course, smoking. Balanced diet is very important. Mediterranean diet is getting a lot of attention. As they say, this is quite good for us, especially menopausal women. Meditation, relaxation exercises. And why do you need to see a physiotherapist if there is a sleep pattern disturbance? We help you with pain management. There are postures for sleep that are important that you need to take care of. Exercise routines that could help you, improve breathing, improve muscle control, and improve general relaxation. And especially for those with obstructive sleep apnea syndrome, sleep apnea, hypopnea, which is like going through those cycles of obstruction during the breathing, as well as there are sinusitis management, rhinitis, which is very common for people, and that can obstruct the breathing as sleep as well. So learning to manage that. So exercises, strength training, yoga, Pilates, similar to what we do for breathing. Relaxation techniques, as I already mentioned. We will just quickly talk about progressive muscle relaxation, which is basically tensing up a muscle to the max and then letting it go to the max. So we're creating an active load on the muscle and then just letting it go so it relaxes. A full maximum contraction of a muscle is always followed by a complete relaxation if we allow it to. So it helps to lower blood pressure. You're not tensing up the muscles, so the blood vessels are easy. There is less anxiety, less levels of fatigue, and less pain as well. So basically what you do is you focus on different parts, like if you're feeling a headache or like tension in the forehead, you just tense up the forehead. You just close your eyes and focus on the breathing on the forehead. Breathe into it, hold that tightness, like squeeze, frown for 4 to 5 seconds, and then completely let go, like as if like there's just a wave of relaxation for the next 8 to 10 seconds. So you start, it's almost like Shavasana, where you focus on every single part of the body, tensing it and then letting go, tensing it and then letting go. That will help achieve relaxation in the body. Pay importance to posture, as I mentioned. For the restless leg syndrome, doing low impact aerobic exercises, doing some calf stretches, basically always engaging like the feet in the morning or at night before you sleep, just pulling your feet up and down, doing a hamstring stretch where you pull the knee closer to you and point your leg up to the ceiling to stretch it, and also working on your foot and toe muscles, like, grabbing a tissue or a little pebble under the foot and moving it out. That will help with the restless leg syndrome. For pain, see a physiotherapist, as I mentioned. Learn how to manage those pains. Get the right guidance from a doctor or a physio or a trainer, whosoever can help you in your required area of discomfort. And for last one, obstructive sleep apnea, because it's like an obstruction. So poor tongue posture also becomes an obstruction. So during the day, as much possible, practice keeping your tongue in the upper palate of the mouth. So it's like behind the upper teeth, into that roof of the mouth is where your tongue should be sitting when you're resting. As much as you can be mindful of, keep the tongue pushed up against that. So holding it there. And to train this, if you feel, you can assess yourselves whether at rest your tongue sits lower. You can practice, like do this 20 times at a go, and you can do multiple times a day. These are called tongue pops. You can do tongue stretches, because tongue is a huge muscle which maintains this airway opening of the nose and the face. So stretching the tongue out in different ways, like it looks funny, but it is actually helpful. So trying to reach the tongue to different destinations as far as it can go will be a useful thing. I also often advise use of mouth tapes, especially for people who sleep with their mouth open, who snore. They are not dangerous at all. These tapes are not sturdy. They're not like keeping you stuck for like too long. Too badly. If you really want to open the mouth voluntarily, it can still open. So there are different options. Like I use myotapes because I'm a Buteyko practitioner, and these are the ones that we use for, which is easy to use. You just sort of stretch the tape, like there's a space for the lips, and you just put it like this and stick it on. It's just like the other exercise tapes, and that sort of keeps the lips together. So it's puckered lips, doesn't let them open. But if I want to move or I want to drink water, it's elastic. So it allows me to do that. That's an option. Or otherwise, just a simple micropore tape would be useful as well, which is basically you just tear a piece and just stick it from top lip to bottom lip. If you've not tried these, some people get anxious about taping their mouth because it's that fear. So you do them in the day, in your waking hours first, to get used to this. And that is I have had so many feedbacks from my patients, and it really is a good game changer, because one, you don't wake up with the dry mouth, you don't need as much of water in the sleep at night, and you don't wake up with a dry mouth. So it is helpful. So avoid prolonged static positions, keep moving. Exercises are important, but don't do exercises 2 hours prior to bed. Exercise earlier in the day, and do gentle stretching. So find triggers for your problem. What causes the changes and how do you improve those is something you need to figure out. So pay attention, practice like all of these things that we've talked about, because they definitely help you gain more control. And if you really have severe symptoms, then look for medical interventions. Go and see a doctor and see what help can they provide you. And if it's like a physio's domain, which is applicable to your problems, we're there to help you. So go and seek help from your physio. Hey, thank you so much, guys. Sorry I overshot with my time because we started 6 minutes late. And here we just want to gather some information, like if we were to do more talks, to talk to you people. So like, what are you all interested in?
10 more seconds, and then I'll be closing the poll. Okay, ending the poll. Right. Okay, thank you so much, Monica, for sharing with us today about menopause. It's been really insightful, and I hope everybody has learned a lot as well, just as I did. So if you can see on the screen that Monica is flashing now, here's our YouTube channel. You may scan it. Alternatively, I've actually included all the links on the chat box if you can access it there. Next slide, Monica. Yeah, and we would really appreciate it if you can fill out the feedback form. The feedback form is also on the chat box as well. And next slide. Yeah, and we are aware that there are some physios who are probably attending the webinar as well. Or if anyone would like electronic certificate of attendance, you may just fill out the form in the link or scan this QR code as well. Yeah. And next slide, Monica. So you can call us if you need any help or advice. We have 2 clinics in Singapore, one in Siglap and one in Orchard. We also have another one in Manila as well, and 2 in Kuala Lumpur. So here are all the details. You may follow us on our Instagram, Facebook, or YouTube channel, which I have also included. Yeah. I see a question. How many CPD unit for this webinar? I believe this is from the Philippines. I will ask my colleague who is from the Philippines. She's probably more better to answer this question, and then I will get back to you on it. Yeah. But I think you can apply because for our previous one, someone did ask and they applied as well. Any
Thank
other
you, guys.
questions? If not, then thank you. Thank you all for attending this webinar. We hope to see you on our next one. Thank you.
Thank you.